Thank you for coming to this today's press conference. Minister Tan See Leng has also dialed in. He's joining us for this press conference. In recent weeks, we have seen a worrying increase in the number of locally transmitted COVID-19 cases. As part of our investigation into the case who resides at the Westlight Woodlands Dormitory, we commenced a special testing operations to test all the residents of the dormitory for COVID-19, and we detected a cluster of cases. We moved quickly to isolate these workers once their results came back. Minister Tan See Leng will share more about this cluster later on. With the emergence of new strains around the world, we have to closely monitor the global situation and look out for local infections, including the presence of new strains. The National Public Health Laboratory has been conducting whole genome sequencing and phylogenetic analysis of COVID cases, and we have detected variants of concern amongst cases in Singapore. These cases had been promptly isolated and ring-fenced. While there was transmission to members of the patient's households, there has not been any further community spread beyond the households. The Director of Medical Service, Associate Professor Kenneth Mak, will provide more details later on. Against this global backdrop of rising cases and emerging variants of concern, we are on heightened alert. The situation in Singapore could escalate quickly if we let our guard down. The multi-ministry task force has also been calibrating our border measures to take into account the global situations. We will be tightening our measures given the deteriorating situation. My co-chair, Minister Lawrence Wong, will share more shortly. Vaccination remains a key enabler in our fight against the pandemic, and we continue to make steady progress in our vaccination program. We currently have 38 vaccination centers up and running, on top of the 20 polyclinics and 22 public health preparedness clinics that are also in operation. Over the next 1 or 2 days, another 2 vaccination centers will be set up. I'm encouraged by the positive response from Singaporeans to the vaccination program. I would like to take this opportunity to thank them for their patience as we progressively invite more people to book an appointment for their vaccination. However, our supply remains limited given the global shortage. I therefore encourage all medically eligible Singaporeans and long-term residents to go for vaccination when it is offered to you. But even as more in the population are being vaccinated, the recent spate of cases has reminded us that we cannot afford to let our guard down. The multi-ministry task force will keep a very close watch on the situation. Should there be emerging trends of increasing transmissions, we may have to tighten some measures. The experience of many countries has taught us that COVID-19 is hard to eradicate. We may get cases and even clusters from time to time. What is important is how we respond when such cases are found. Let us continue to be socially responsible and adhere to the safe management measures, including for those who have been vaccinated. If we all work together and remain vigilant, we can help to keep the local infection under control and to keep one another safe. I'll now ask my DMS, Professor Kenneth Mak, to give a quick update.
Thank you very much, Minister. As of the 22nd of April, 12 p.m., the Ministry of Health had preliminarily confirmed 2 new cases of locally transmitted COVID-19 infection. And based on our investigation so far, 1 is in the community, 1 resides in the dormitory. In addition, there are 22 imported cases who had already been placed on the stay-home notice upon arrival in Singapore. And in total, there are 24 new cases of COVID-19 infection in Singapore today. As part of our investigations into case 62181, who was announced earlier, the Ministry of Health and the Ministry of Manpower had commenced special testing operations to test residents of Westlight Woodlands Dormitory for COVID-19 infection. And so far, 17 recovered workers were found to be positive for COVID-19 infection. All these cases have been immediately isolated and conveyed to the National Center for Infectious Diseases, or NCID, where an expert panel has been, is assessing all these cases and will investigate whether any of these cases are reinfection cases. We're still working through the details of these cases, and further updates will be shared via the MOH press release that will be issued later tonight. We've also issued another press release this afternoon concerning viral variants of interest and viral variants of concern that have been encountered in Singapore. As of the 20th of April, we have detected 7 local COVID-19 cases with the B117 variant and 1 local case with the B1351 variant. This is otherwise known as the South African variant. Case 61822 with the B1351 variant, or the South African variant, works in the marine industry and was exposed to potentially infectious sources from ships visiting Singapore. The remaining 7 cases that we've identified, and these are cases 59028, 59059, 59084, 59340, 59351, 60389, and 60439, were all infected with the B117 variant, and this is otherwise commonly known as the UK variant. All necessary public health actions have been taken promptly to isolate and ring-fence all these cases. And while there have been transmission to members of the same household for 3 cases amongst these 8 cases, there has not been any detected further community spread. In addition to these local cases, we have detected 342 imported cases, travelers from various countries coming into Singapore with the B117, the B1351, the P1, a Brazilian strain, otherwise known as the B11281, the P2 variant, otherwise known as the B11282 variant, and the P3 variant, which is known as the otherwise known as the B11283 variant. The B1525 and B1617 variants have also been detected among imported cases into Singapore. All these cases have already been placed on stay-home notice or isolated upon arrival in Singapore, and we have not detected any further community spread for any of these other variants of interest. We continue to test all cases of COVID-19 infection that we've detected, but as more cases are reported, more testing is done. These numbers will change over time, and in the future, we may provide further updates to you. Thank you.
Thank you. I would like to now invite Minister Tan See Leng to share his comments on the dormitory cases.
Thank you, Mr. Dah, and good evening, ladies and gentlemen. We would like to share our findings thus far from the investigations at the Westlake Woodlands Dormitory, as well as the enhanced measures that were put in place to manage the situation. On the 20th of April, a migrant worker living in the Westlake Woodlands Dormitory was tested positive for COVID-19. And this is part of the reserved rostered routine testing, the RRT. And he was confirmed to be infected with the virus. Investigations on the possible source of the infection itself is ongoing. And MOM, Ministry of Manpower's ACE Group, as well as the Ministry of Health, immediately made 3 key moves to quickly isolate, to detect, and also contain the infections. First, we isolated around 30 of his close contacts within the dormitory as well as his workplace and placed all of them on quarantine. One of the close contacts, the roommate of the index case, was found to be COVID-19 positive at a dedicated quarantine facility. Second, as a precautionary measure, we conducted a special testing operation at the dormitory, and around about 1,200 workers were tested and placed under quarantine. Through the special testing operations, 17 workers previously assessed to be recovered tested positive for COVID-19. We immediately isolated these workers and we conveyed them to the NCID to investigate for possible reinfection. Clinical investigation is ongoing, and NCID will need more time to establish if these are prolonged shedding from old infections or they are indeed reinfection cases. Third, to prevent and contain the possible spread of infection in the dormitory, we imposed quarantine orders on workers at the affected block and widened the extent of the special testing operations to the entire dormitory. and restricted movements out of the dormitory until testing results are out. Now, ladies and gentlemen, given the global backdrop of new variants of the virus and a worsening situation in the region, we will be tightening public health measures relating to migrant workers with immediate effect on two fronts. First, our border measures, and secondly, our surveillance measures. For border measures, all newly arrived migrant workers from higher risk countries, including those with positive serology results, will have to undergo a 14-day stay-home notice at a dedicated facility. They have to complete the 14 days SHN and clear their COVID-19 tests before they undergo onboarding at the Migrant Workers Onboarding Center, or MWOC, for further monitoring. They will also have to clear a PCR test before they exit the MWOC. For surveillance measures, all newly arrived migrant workers, including those with a positive serology result, will be enrolled as well onto RRT every 14 days after they have completed the stay-home notice and their stay at the onboarding center. Now, MOH and MOM have always closely monitored the situation for recovered workers. The latest scientific evidence from the cohort of recovered persons in Singapore nearing 1 year from the date of infection suggests a possible gradual decrease in their antibody levels. Although this is just one indicator of immunity, given the new variants of the virus emerging, the risk of breakthrough immune protection could have increased. Therefore, as an added measure, MOH and MOM will revise the testing regime for all recovered workers. From 29th of April, two groups of workers living in Singapore will be enrolled back into RRT once they cross the 270-day mark, or 9 months, from the date of their past COVID-19 infection. All recovered workers currently living in the dormitories and workers in the construction, marine, and process, or CMP sector. Both MOH and MOM have decided to take this step after jointly reviewing the testing regime, and this is in consultation with infectious disease specialists. With these additional precautions, we will be casting the net wider, allowing us to intervene more quickly and stepping up measures to contain any detected infections. These re-emergences of cases in the dormitory remind us of the need to stay vigilant. We seek the cooperation of migrant workers, of employers, and dormitory operators to continue to work with us and to safeguard the lives and protect the livelihoods of our migrant workers. With that, ladies and gentlemen, I'm going to hand this back to Minister Gan. Thank you.
Good evening. We've been monitoring the COVID-19 situation in India very closely, and all of you know that we made a move to tighten the arrivals from India on Tuesday. But since then, the situation in India has continued to worsen. Within our community, as you heard just now, we've also picked up a few cases in the dormitories. Now, there is no evidence that these cases are linked to India or the new strain in India. But what is of concern to us is the risk of reinfection amongst recovered workers. These are workers that were previously infected, but now are getting infected again. The majority of new arrivals from India work in the construction, marine, and process sectors, and they live in the dormitories. Even if they were to serve out the stay-home notice, we know that that is never 100% foolproof, and leaks can still happen. And if such a leak were to happen amongst new Indian arrivals working in these sectors, then a new strain may get leaked into the dormitory, and worse, even recovered or vaccinated workers may get infected, and then we may see new clusters emerging again in our dormitories. So as a precaution, we will be taking additional steps to tighten our border measures on top of what you heard from Minister Tan just now. From 23rd of April, 2359 hours, all long-term pass holders and short-term visitors with recent travel history to India will not be allowed entry into Singapore or transit through Singapore. This will also apply to all those who had obtained prior approval for entry into Singapore. Earlier, we had announced an extended stay-home notice of 21 days for those travelers with recent travel history to India, and that 21 days was made up of 14 days in a dedicated facility with the option of serving out the remaining 7 days at the place of residence. We will tighten this further such that all Indian arrivals from India will have to serve out their stay-home notice in dedicated facilities. We know that this major move will have an impact on our construction, marine, and process sectors. And many local SMEs and contractors will be badly impacted. The government will be looking at providing additional support measures to help these companies. We are reviewing to see what these support measures will be, and we will announce them when ready. For the construction sector in particular, there have already been delays in building and housing projects up to now. I think with this additional restriction of workers, there will be further delays in projects. So I seek Singaporeans' patience and understanding. If certain projects were to be delayed further, please understand why this has happened and know that we are doing this because of public health reasons, and we have to make this additional measure, and we hope that everyone will cooperate. Finally, I think the situation we are in, reminds us once again of how unpredictable and volatile the pandemic can be. It's been more than 1 year since we've started this fight against COVID. Things are fluid, they change rapidly, and we have to be prepared. We are facing an invisible and very formidable enemy, and the new strains of the virus that we see in many other countries, I think, are worrying because it suggests that we have to continue staying on guard, even tightening some measures, and even perhaps after this round of vaccination, we might have to continue with further rounds of vaccinations, even up to beyond this year, because we will have to be confronting not just the virus today, but potentially new strains of the virus that may be more infectious and virulent. So once again, we call on everyone to stay alert and vigilant. The fight against COVID-19 is not over, but working together, we can emerge stronger and we can defeat the virus. Thank you.
Thank you. And I now invite questions from the media.
Thank you, Ministers. DMS, we will now begin the question and answer segment. Media agencies, please remember to use the raise hand function on Zoom if you would like to ask a question. Do also remember to unmute before asking your question. May we have the first question from Ray from ST, please?
Hi, good evening, Ministers. Thank you for the information. Can we ask about how concerned exactly are we about the emergence of these new variants, especially the so-called double mutation variant from India, and the phenomenon of reinfections? And does this, beyond the dormitories and the measures related to migrant workers, does this affect our plans for further reopening?
I'll ask DMS to talk about new variants, and maybe Minister Tan See Leng can respond to the question on the dormitories.
Thank you very much for the question. We are indeed monitoring the situation very closely. There are emerging evidence that some of the viral variants of concern may have an increased risk of breakthrough, but yet at the same time, for many other variants, this has not been seen. The data for The double mutation variant, which you mentioned, is still emerging, and we are monitoring the situation closely to see whether this would be a concern, particularly for us, in relation to travelers coming to Singapore and at risk of imported cases. You've asked also about reinfected cases, and these would obviously be in persons who have recovered from infection. We do know that persons who recover from infection, the majority of whom develop an immune response that does protect them for a significant period of time from further COVID-19 infection after they recover from that first infection. However, over time, there have been studies that show that for some individuals, the antibody levels that are present in their body do wane over time. We've done our own local studies looking at two different populations, one followed up by NCID for recovered cases in the community, and a second that looks at workers in the dormitory setting being followed up, and we demonstrated that in both groups, they retained the antibody response for significant periods of time, well above 300 days. However, over time, that antibody response does come down, and it is theoretically possible for a recovered person to get reinfected subsequently. And this is the reason why we want to be vigilant, particularly now when a number of our own recovered workers are starting to reach that milestone where they are above 300 days, and it's now prudent for us to start monitoring very closely for the risk of reinfection taking place. And this would be the basis for our enhanced posture for testing, not just among workers, but also for travelers that come into Singapore. And we will continue to be vigilant, looking out for reinfected cases as they arise.
Seeling, you want to add?
Yes, thank you. Thank you, Kenneth, for the comprehensive explanation. Now, I think to add to what Professor Mark has alluded to, over in the dormitory itself, we have also tightened the onboarding of the recovered workers onto the RRT regime. And as I've alluded to earlier on, we have tightened it to 270 days. This is in spite of the fact that studies have shown that the immunity lasts beyond 300 days. We thought that as an evidence-based study has shown us, we actually maintain a tighter and a safety margin in terms of a buffer for us. So we migrated the bulk of the migrant workers, with the recovered ones at the 270-day mark to start that RT. That actually allows us to cover a fairly sizable and significant majority of the population of the recovered workers. On top of that, we will continue to enforce very strict safe living measures to ensure that the intermixing at the dorms itself is continually maintained. The contact tracing in terms of using both Blue Pass and TT tokens will continue, and it allows us another set of triangulation. On top of that, we also use wastewater testing to pick up fragments of the virus. So I think it's important that we should see this in the context that this was a preemptive operations that we took and this preemptive special ops that we have undertaken allowed us to uncover this infections within this particular dorm itself. Now, as far as the easing of restrictions, we did plan for some easing of the restrictions, but given the fact that today we have got new variants of concern, and I think you can see that we have also got this new number of cases that have come up, we've decided to put it on hold for a while. We hope that you can help us to garner support and also patience from the migrant workers, from the employers towards our measures. And we will do everything possible in a very careful, measured and calibrated way when once the numbers are down again. Thank you.
Thank you. Next question.
Can we have the next question from Chao Pao? Waiman, please.
Hi, good evening, ministers. Two questions on the dormitories. Can the task force share what is the current vaccination numbers or rate for the migrant workers? And since vaccination is ongoing, many are also wondering if the migrant workers who have been recently found reinfected with the virus, have they completed their vaccination? If so, what is the current assessment of the efficacy of the vaccine and is the task force concerned? Thank you.
Thank you. Siling, you have the numbers?
We have done. I think we have actually focused the vaccination on the COVID naive workers, and we have been very mindful in terms of stratifying the ones in the higher risk dorms itself, those that live in larger dorms itself. I think to that end, we have done. I think about probably more than 30,000 vaccinations given. Some, of course, have completed the 2 doses, and some of them have completed at least the first dose. Now, with regards to the 2 cases that have been diagnosed as positive after the vaccination, my understanding is that the first case had the vaccination just less than 2 weeks. The second one was after 2 weeks of completing the second dose. Perhaps Professor Mark can confirm that.
Thank you, Minister. Just a few additional figures. I do have some data at hand. Overall, there have been about more than 8,000 workers from the CMP sector who have received their first dose only, but 34,000 workers in the same CMP sector who have completed their second dose. So we continue to work towards vaccinating as many of our workers as possible, just as we vaccinate all frontline workers, healthcare workers, and those who are vulnerable, all of whom have an increased risk of getting COVID-19 infection as a result of either the work interactions or the exposure they will have in their unique work and living settings. In terms of the cases that we've reported so far, indeed, we have seen a few cases that have had vaccinations done. Prior to the cluster that we're examining now, the majority of these cases occurred before we think they derived full immune protection from the 2 doses of vaccination. And it's not implausible then that to think that they were still vulnerable to infection because they hadn't mounted the complete immune protection from vaccination itself. However, we have seen a few cases as well. I don't have the exact numbers. We can provide it to you later. I understand that that number may be 2, but we'll verify and check that. Where they've in fact had vaccination beyond the second dose and then subsequently got infection. This reaffirms that while vaccination gives a clear protective benefit to all who may be exposed to COVID-19 infection, the vaccination is not 100% protective. It does a very good job of protecting you, but you may still be at risk of getting infected despite being vaccinated. And this is also the reason why we continue to encourage all who have been vaccinated to remain disciplined in their mask wearing, their safe distancing measures, and this applies equally to those in the community as it does to those who are workers working in the CMP sectors. We'll provide further details as it comes out concerning the cluster, how many of them who may have been vaccinated and how many of them ultimately were found to be reinfected, and that will give you further details concerning the reinfection rates in this group.
Thank you. We do know for a fact that vaccines, sometimes even if you're vaccinated, you continue to be vulnerable because there's effectiveness is, for Pfizer and Moderna is between 94 to 95%. So there will continue to be a risk of infection. So that's why we have adopted a multi-pronged approach to our defense against COVID-19. First, we have vaccination to protect and to prevent. At the same time, we also introduce safe distancing to make sure that we minimize the transmission in the community. And on top of that, once we have a possible case, we do contact tracing, we do testing to detect as many cases as possible, as early as possible. And after that, then we do isolation to make sure that to minimize the risk of transmission. So we need to take a multi-pronged approach in our defense against the COVID-19. And at the end of the day, it also requires all of us to cooperate and to observe all the rules and regulations that we've put in place to ensure safe distancing and to protect every one of us. So I think we have to understand that to be effective in our defense against COVID-19, we have to ensure that all these measures are in place. Next question.
Thank you, Ministers DMS. Can we have the next question from CNE? Isabel, please.
Hi, Ministers. Thank you for the information this evening. I just had two questions. The first is currently the cases of dorm residents that tested positive for COVID-19, 17 of them were recovered from a previous infection. Can I just clarify, based on this, I understand that the vaccination process currently going on in dormitories excludes recovered workers, or rather the vaccination is given to those who have not had a prior COVID infection. Given the recent cases, will this eligibility be reviewed? The second is on a possible third dose of the vaccine, of being vaccinated. I think it was mentioned just now that it may be a possibility that subsequent doses to guard against new variants and more regular doses might be required. Can we have maybe an idea if there's going to be a confirmation of a third dose in line with the current vaccination regime? Thank you.
I can answer the first point, Isabel. Indeed, for the recovered workers, we were planning to give them a single booster dose because studies have shown that there is a boosting of the immunity after you've given them a single shot. So we do have plans for that. I think that obviously the key thing is that we have also got to titrate the vaccine schedule according to the national vaccination schedule, because in terms of making sure that our Singapore citizens, our own population also gets vaccinated. So I think all that is under a big master plan, and we work very closely with MOH on that.
Indeed, as Minister has shared, when it comes to the migrant workers, we have been bringing them forward. We identify them as a group of people who do have an increased risk, not only of getting infected, but potentially of spreading infection as well. And it is in our interest and in their interest to make sure that they're adequately protected. However, within the worker population, we have been prioritizing those who are naive. In other words, they have not been infected before because their risk is the highest, well above those who have actually recovered from infection. And as we seek to prioritize them, we will also subsequently also bring those who have previously recovered from infection to come in also for further vaccinations. With regard to the third dose, this is something we've been studying, and other jurisdictions, other ministries of health in other countries have been looking at the same issue as well. At this point in time, there's quite a bit of thought that the vaccinations should be able to last us for at least 9 months, 12 months. We believe that it's going to be much longer than that, perhaps even 15 to 18 months. But beyond that, it's still a relatively uncertain situation. And there are two developments that may influence us in our thinking about giving further vaccinations, even to those who have received the first two vaccinations already. The first is, just as recovered workers may eventually have a gradually waning immune protection, this may also apply to those who have been vaccinated. And therefore, as we do tests following up some of these individuals who have been vaccinated, and we find that immune level starting to drift downwards, this would then be the right time to start planning to vaccinate these people as well. The other consideration are the viral variants of concern, where at this time, the vaccines that we've chosen, the Pfizer and Moderna vaccine, have shown still efficacy against these variants of concern, but we have to prepare for the possibility that there may be future variants that where the vaccines that we currently use are not as efficacious. And if that were the case, it may well be the case that we need booster vaccine doses to augment the immunity that we already have from the previous vaccinations and to give us additional protection, particularly against these variants of concern. So this is something we're studying very closely, and we discussed this with our counterparts in other countries. The manufacturers are looking into this as well, and they hope to produce improved versions of their vaccine that will have enhanced protection even against these emerging variants of concern. And where such a product is available, we may plan to make that available as booster doses in the population that had previously been vaccinated already.
Thank you, Ministers. DMS. Can we have the next question from Reuters? Chen Lin, please.
Good evening, Ministers. I would like to ask, how concerned are you about a second wave of outbreaks among the dormitory residents like the one last year due to these reinfections? Thank you.
Thank you. Yeah, Sireng?
Yeah, thank you. We have never let our guard down. I think we are always concerned as we look at news reports and sort of ostensibly also learning from the experiences of other countries. And hence, we have always maintained constant vigilance. We have constantly based it on the evidence that is made available to us. And as I've alluded to earlier on, with the evidence that has been gleaned from studies and so on, we have then put on another buffer in terms of a safety margin. We have also adopted multi-pronged strategy in terms of safe living measures, very targeted contact tracing, to also make sure that the restriction of movements and so on and so forth are kept in place. On top of that, the infection prevention control committees continue to work with the FAST teams to audit and make sure that safe distancing measures, safe living measures are adhered to strictly. And we also work with many of the employers in terms of counseling and talking to the workers who live in the dorms. I think this cluster itself, as I've alluded to earlier, was a preemptive special ops that we undertook, and we picked up this thing. We will continue to tighten and widen the net, looking at the evidence and also the cases that we see, understanding whether they are old infections, they are persistent shadows, or whether these are new infections. I think the main thing that we do take more comfort in is that given that the past 1 year, we have been able to see how many of the measures that we have adopted has thus far allowed us to carry it to such a stage. I think moving forward, we will continue to maintain close surveillance and close monitoring and working very closely with all the different agencies, with the support of MOH, with the support of MND, BCA, and many of our colleagues in MOM, and also rely on all of you to educate everyone on the importance of safe living measures to avoid a second wave. Like I said, we want to take a very, very measured approach. So we hope to have all of your support and cooperation. Thank you.
Thank you. We just have to remind ourselves that we are always one case away from a big cluster, and we are also just one cluster away from a big wave. So we're always on our toes, and we take every case seriously, and we investigate very thoroughly to find out where the case came from, where is the source, and to follow through to ensure that to track all the close contacts to prevent further transmission. And that is how we actually picked up this cluster at Westlight. I should also clarify that some of the cases that we announced recently may eventually turn out to be old cases, like we have done before, but we nonetheless take all the necessary public health precautions, assuming that they were acute cases until they are proven otherwise. So this is the approach that we have taken to make sure that we do what we can to minimize the risk of a further transmission and to minimize the risk of the next wave coming.
Thank you, Ministers. Can we have the next question from Yahoo? Nicholas, please.
Hi, so my question is with regard to the 342 imported cases of new variants that was mentioned earlier and which Yahoo reported on yesterday. My question is, why are the variants of concern detected in Singapore not regularly tabulated in the MOH updates to the public? Instead, they seem to appear rather piecemeal, with initially the British variants being updated here and there. So can we have an understanding of how MOH classifies the importance of each variant in our context, and going forward, does it intend to provide regular updates on the number of such cases of new variants being detected in Singapore?
Thank you very much, Nicholas. Indeed, we will be providing updates from time to time concerning the situation. But it's important to understand how testing is done and how that information then would be made available. We have a policy of testing all cases that we diagnose to have COVID-19 infection. This is in view of the fact that variants of concern are an increasingly important concern, and that in many of the countries around us, where travelers come from and come into Singapore, these variants of concern have been reported with a high degree of frequency. So we will be testing all COVID-19 infections to assess what variant or what strain they have, but that testing takes time. And the results do not come out at the same time when we report the cases that we diagnose and detect, and therefore it's not possible to give you that information in real time at the time when we provide our regular updates about cases that we detect and we announce. But that said, once we have information, rather than that information coming out in drips and drabs, we will provide updates at intervals, just as we're doing today, which will give you those aggregate numbers, which allows you to better appreciate what the situation is when it comes to these variants being present among these cases in Singapore. We are also looking very carefully to see where these variants, what type of cases these variants are emerging in. And while we remain vigilant, we note that the majority occur in imported cases. In other words, these are travelers coming to Singapore and they have been subject to isolation, SHN measures, and we pick them up during the testing, during the isolation period or the end of the isolation period. So because of this, they have not mixed freely in the community, and the risk of spread of infection from these cases where there are variants of concern has not occurred. That said, we focus also on the local cases we've detected so far, and it is particularly important for us to continue our practice of early detection, isolation, contact tracing, drawing that net tightly around these cases to prevent further spread. And so far, we have not detected further spread beyond the household for these cases.
Thank you.
Thank you, DMS. Can we have the next question from Channel 8 TV News? Shu and Tan, please.
Hello, good evening, ministers. Apart from the workers living in the dorms, we also have some migrant workers who do not live in the dorms but in shophouses of private housing. Apparently, they might have interactions with workers who live in the dorm due to work and hence establish a contact point to a wider community as a whole. So this, which is a concern to the community, would like to check, is there any measures taken to minimize the possible spread of virus to the community? And also, my second question, in the last MTF briefing, it was announced that government will allow the scaling up of activities with pre-event testing, and all this will only take effect 2 days from now, which is 24th of April. So wondering, with this latest development, is there any adjustment of the timeline to the earlier announcement? Thank you.
I'll take the first point, Sushan. Thank you for the question. For the migrant workers who do not live in dorms, as I've alluded to, they either carry the blue pass or the trace together, and all the interactions in the work site itself, we have very aggressive contact tracing regimes and protocols in place to track them. Now, my understanding for this particular dorm group that we have picked up, the bulk of them are from the marine sector. Today, we have also issued a stop work order in the particular, work site where these migrant workers were working in. On top of that, quarantining those affected, as well as making sure that the rest of them are kept within the dorm itself. So we think that the measures today that we have done are adequate. We continue to pursue all possible leads. And simultaneously, as I've also shared with you earlier on, we will be moving to tighten the RRT to those recovered workers from 270 days onwards. So with all these measures in place, we are now doing about 20,000 tests a day for all the workers who work in these work sites. So that is the equivalent of about something like 600,000 tests in a month itself. So we believe that the measures today are wide enough. But what we will do is that we will continue to widen the net if we think that the numbers show otherwise.
On the second question, for the time being, I mean, we continue to monitor the situation in the community very closely. And as all of you know, we adjust our measures based on the infection situation. For now, we have no plans to change the current prevailing rules or to change what has already been announced. But I'm sure you all appreciate that this is a dynamic situation, and the situation is changing by the day. As you heard from Minister Gan just now, we are always one case away from a cluster and one cluster away from a wave that can happen easily. I have no doubt that throughout this period, even from last year all the way till now, while we think that the community cases are every day you see zero or very low, I have no doubt there's still a very low underlying rate of transmission going on in the community. This has been the case all this while. So whether or not that underlying rate of transmission explodes into a new cluster really depends on all of us complying with the rules, cooperating with the measures, and doing our part to be responsible. For example, if we fall sick, see the doctor very quickly, do not go out, and get yourself tested to make sure you are not infected with COVID-19. So these are all basic things that we've been emphasizing, and we hopefully everyone cooperates and we can maintain this level of very, very low infection rates and then contain the situation that we are seeing in the dormitories now, and we can still continue with all the things that we had planned for earlier, be it relaxation of measures in the community, or even later on some of the potential for travel. But because so many things are uncertain, I think we just have to continue to monitor, and if the situation warrants it, we will then have to step in and tighten up some of the measures. We have to be prepared for these ups and downs throughout this period, as we have seen over the last year, and will have to continue to go through this year.
Thank you, Ministers. Can we have the next question from Tamil Murisu? Irshad, please.
Good evening, Ministers and DMS. I would just like to ask the question regarding the worrying case of increased numbers in India. So with that situation in India, is there any travel advisory the government is looking to issue to Singapore residents who have plans to travel to India? And then with the next question is about the dormitories. Is there any specific measures, stringent measures that such as restricting the movement of workers that we're planning to implement? Thank you.
The travel advisory remains as it is, but the broad travel advisory remains as it is. But I would say, anyone who wants to travel overseas, and when we have imposed now this restriction on travelers from India coming back to Singapore, and so if someone from Singapore now wants to go to India, has to be prepared that potentially they will have difficulties coming back. That's what they have to be prepared for. Perhaps somebody who's returning there for long-term or going there for long-term purposes, yeah, we won't restrict that movement. But whoever goes there and hopes to come back to Singapore soon, I think that would potentially be difficult because we are restricting the travel and potentially there'll be very few flights coming in. So I think coming back from India would be very difficult for the time being. We don't know when we will lift this new restriction. This is really a temporary freeze on arrivals from India so as to give us time to monitor the situation in India, to understand better the new variants that are there and the risk they pose to us, and at the same time, for us to have the time to clear out the situation that we have seen recently in the dormitories.
Yeah, thank you, Ashar. So for the dorm in Westlake, with immediate effect, the workers living in there will not be allowed to the recreational centers. And at the same time, for both the blocks, one for the dorm itself, there's I think there are about 1,000 over workers who have been isolated at the GQF, the government quarantine facility. The rest of the workers have been isolated within the dorm itself, and at the moment they are all sort of restricted to within the dorm, and they cannot leave the dorm until further investigation and results are known.
Thank you. Perhaps next question.
Thank you, ministers. Can we get the next question from today? Eugene, please.
Hi, I just have two questions. The first one is, I just want to clarify if vaccinated workers still need to go back to do their roster routine testing. And the second question is, what is the vaccination status of the 18 workers who are found to have been infected so far at the Westlake dorm? Thanks.
The answer to your first question, Eugene, is yes. Those who have been vaccinated will still go back to RRT. So you recall that the first case was after he had his vaccination, we did RRT and we picked it up. To the second point, I think DMS, Prof. Mark can give you an answer.
Eugene, can you repeat that question? I lost the last bit of your question. Okay.
So for the second question I was asking, what is the vaccination status of the 18 workers who have been found to be infected so far at the Westside dormitory?
I don't have the information immediately here, but I'll check that on that. I'll try and give you a response as soon as possible.
Okay, next question, please.
Thank you, Ministers. DMS. Can we get the next question from the Age Singapore? Hui Chie, please.
Hi, good evening, Ministers, DMS. I think I would like to ask about two media reports that have emerged. One that was from CNA about 11 cases in the dorms, the reinfections. I would like to ask if you could shed some light. Would they be counted as existing cases or new cases because they were not included in the counts? And I think for my second question also is Bloomberg also reported that there was a travel announcement supposed to be released today regarding Singapore and Hong Kong. I would like to ask, can you comment on the status of it?
I'll take the first point, Hui Jie. The 11 workers that you read about was yesterday. I think that the report came out yesterday. The majority of them were actually recovered workers. So because they're recovered workers, we picked up through the RRT itself that they had this lower CT value, and hence it was a reinfection. Now, for some of the cases that were mentioned in today, which is that summary of the whole number, that 17, there was a number of them, I don't have the exact number, that had very high CT values. So that's why I said that currently they are under investigation with NCID to see whether they are indeed recovered workers but are persistent shedders. So I don't have that detail because that investigation is still undergoing. As Min Gan had alluded to earlier, the situation is very dynamic. Because these people didn't have symptoms, we actually proactively and preemptively went to test them, you see. So we're waiting for the more sort of refined investigations to come out from NCID and from the national labs before we can comment further. For the air traffic, sort of the air travel bubble with Hong Kong, I think maybe perhaps Min Lawrence Wong can shed some light.
Sure, thanks, Siling. So on this, I believe MOT had issued a clarification. They had mentioned that both sides have indeed been discussing the possibility of the resumption of the air travel bubble, but no date had been fixed, although we certainly look forward to doing this as soon as possible. But the broader point is that really in this very fluid environment, all of us just have to be prepared that each time we talk about putting in place a new initiative, be it within the community or for travel, we can only do so when conditions are suitable and appropriate, when they are safe, and that requires us to monitor the situation. It requires us to ensure that on both sides for travel, the situation is appropriate, it's safe, before such an initiative can take off. Even after an initiative is launched and travel were to start, things can change after that. You could have cases going up in either side, and then it may well happen that along the way, something like this may have to be suspended temporarily, a pause in order for the infection to be controlled on either side. So again, we just have to be mentally prepared. This is the reality. It's part of the new normal that these things have to be done for safety, for control of the infection. As much as we would like to resume activities, and we will try to do so, but it has to be done safely, and from time to time, temporary suspensions or temporary stops may well be needed in order for any outbreak or any new case to be properly contained. So that's our overall approach, and that's certainly the approach that Hong Kong takes as well, and therefore, at an appropriate juncture, both sides will announce the resumption of the travel bubble.
In response to Eugene's question just now concerning the vaccination status, the person who was quarantined and detected to have infection was vaccinated, but the 17 cases we had described as recovered workers, none of them were vaccinated. So these were recovered workers who have as yet not received vaccination yet. More information will be provided later.
Thank you, Ministers, DMS. We have now time for last 3 questions. Can we get the next question from Financial Times? Stefania, please.
Hi, good evening. I had a couple of questions. The first one, they're both in relation to the press release that was shared with us. Here it says that Singapore is reviewing border measures for recovered travelers. Is this beyond the migrant worker community, and what are potential measures that you are considering to impose on recovered travelers coming into Singapore? And the second question, I just wanted to clarify a point about what in the press release is referred to public health measures. So the release says that as of the 29th, recovered workers in dormitories and CMP workers who have crossed 270 days from the date of infection will no longer be exempted from public health measures, which, correct me if I'm wrong, those include quarantine orders and widening the extent of special testing. So I just wanted to clarify, does it mean that essentially all migrant workers slash CMP workers that have recovered and have passed the 270 days will be facing sort of isolation or quarantine orders? When would they be facing these quarantine orders? How would that work? I think the testing is clear, but on the quarantine orders, I just wanted to understand when that would apply.
Thank you very much for your question. I'll start by answering the first question you had concerning travelers into Singapore who had recovered from COVID-19 infection. Indeed, we have plans to introduce additional measures. We are in the process of finalizing these measures, and we'll make further announcements in due course to give you more details on this. We are concerned that while the majority of recovered travelers would be immune or protected from infection and not carry infection into Singapore, there is a possibility that some of these travelers may have reinfection, and we've seen such cases already. And with the neighboring countries where travelers come from having such high rates of community infection, that risk becomes increasingly significant. So we are looking to see whether there's a need for some isolation, SHN type measures, not dissimilar to those that we are currently requiring naive travelers, those who have not had infections before, to undergo, but the details, the further details will be made known at a later time. Together with such SHN equivalent measures will be testing, and that testing will allow us to clarify whether any of these recovered workers carry reinfection into Singapore. Concerning the second question, which seeks to clarification concerning what public health actions mean for recovered workers who go beyond 217 days from the onset of their original infection. At this time, we intend to put them back onto a regime of routine regular testing. And this is not dissimilar to those who currently have not been exposed or not been infected yet. They are currently engaged in routine regular testing. But once the recovered workers pass this time point that we've chosen, we intend to put them back onto that testing regime so as to look for and detect early any potential cases of reinfection in this community of recovered workers. If any of these workers turn out to have a positive test, then the relevant actions to isolate and further assess them then kick in. And that further assessment is necessary to determine whether indeed these workers have a reinfection.
And if I may add, the bulk of it, Stefania, is the RRT, the rostered routine testing. Once they've passed for the recovered workers, once they've passed day 270, and if any of them have a confirmed positive, then the close contacts would also be subject to quarantine. That is in response to your question about any additional quarantine orders. So through our contact tracing, say close contacts could be living in the same room, same bunk, same level, depending on that level of interaction. And obviously, we hope and we would expect that all of them to adopt safe living measures to ensure that they do not sort of come into close contact with one another. But to the extent that we trace them, the close contacts will also be subject to quarantine orders.
Thank you, DMS. Thank you, Minister. We'll have the next question from BT. Janice, please.
Hi, Ministers. Thanks for this. I have two questions. The first question is about the border closure with India and the likely magnitude of the impact on the manpower situation. So if we could get a sense of the likely shortfall of workers as a result, and how many workers have already got prior approval but will now be unable to come in? So that's the first question. The second question is about the sort of support that firms may receive. I mean, I know you said that you're still working out the details, but I want to get a sense of the universe of possibilities. So would it be in the line of earlier forms of support that we've already seen, or could we have new things such as, say, an offset for greater costs with this migrant worker onboarding centers, especially now that presumably the cost difference between the recovered and the COVID negative might have to go, given that you're kind of putting them on a stricter regime. And also whether this would be sector-wide sort of support, maybe with some eligibility requirements, or would it be just for firms who are directly affected? Say they can't get in their workers, or they have got stop work orders and so on. Yeah, thank you.
The number of workers coming in would definitely be affected, and I think you can imagine that given the magnitude of the number of projects that we have here locally, we would expect to see delays moving forward. On top of that, we are working across the board between Ministry of National Development, Ministry of Health, as well as Ministry of Manpower, and with the support of Ministry of Finance. I think we will work together to see how we can better support the industry, both in the form of construction, as well as some of the other big projects, from the CMP side. So I think these are things that we will be further looking into, and the whole of government would step in to work together to see how we can support them. Now, I think you can appreciate the fact that today, the health of the workers within the dormitories and also the public health of all of us as a nation is of paramount importance. We do not take such decisions lightly. I think it's important that given the fact that we now see this variants of concern popping up, and also many countries in the region having this successive waves of infection, this actually allows us to make sure that our own health facilities do not get overwhelmed. Because the last thing you want is that if our own healthcare facilities, our beds get overwhelmed, then I think we're going to be in a much worse off situation. So if anything at all, I think you can see that this will allow us lag time to also ensure that our healthcare facilities can manage. And I think I'll leave that part of it to Min Gan, perhaps, and Min Wong to further elaborate.
Well, Janice, I think you are asking a question that can only be answered at the next press conference, because we really are not in a position now to talk about specifics of the help measures or the support measures. And I try not to hint at what they are either. All I can say is we are aware and mindful that this will have a major impact on companies, particularly in the construction, marine, and process sectors, because these are the ones who are quite reliant on the new arrivals of workers from India. So they will be the ones who are directly impacted. So we are mindful of this, and that's why we have been already, even before this move on Tuesday, when we tightened the inflow of workers, we already knew this would have an impact, but more so today with the complete freeze on arrivals, and therefore we have accelerated the work on the help measures, and we will announce them when we are ready.
I just want to add that we have actually taken a very careful consideration before we introduce these border control measures. And these measures are necessary because you can imagine that the alternative is to have influx of cases, and in fact they may transmit to our dormitory, to the community, and we end up with a major outbreak again. And at the same time, you'll find that if that happens, actually many more companies will be affected, many more workers will be affected, and the economy will be even worse, affected more badly than what we could see now with these measures. And on top of that, we are also concerned about our healthcare facilities and capacity, because we do want to preserve our healthcare capacity in the event that there is an outbreak. So we want to do what we can to minimize the risk of the next cluster and the next wave, so that we have sufficient capacity of our healthcare facilities to be able to respond should the eventuality happens. So therefore, it is important for us to take that into consideration when we look at the measures that we are introducing today.
Thank you, Ministers. We'll have the last question from Shin Min. Gek Ling, please.
All right. Hi, ministers. So my two questions. My first question would be, can we have a rough sense? How many days does it take for NCID to determine whether is it a reinfection? And my second question would be on for the 17 recovered workers who were tested positive. Are they all from Block A? And correct me if I hear wrongly, because were these 17 of them mainly from the marine sector? Yeah, these are my final questions.
The amount of time it takes varies from case to case. In general, it would take usually 2 to 3 days for them to be able to make an initial assessment from the serology test as well as the PCR test information. But on occasion, these tests may give an equivocal picture, and they may have to then follow through with serial tests done to look at trends to determine whether or not the pattern of these results is more in keeping with an acute infection in the setting we're talking about, a reinfection. So this may vary from a few days to even up to a week or two. We hope as more information comes in to give you timely updates so that you have a better understanding about how this cluster is progressing and how we are controlling this cluster.
To your point about the bulk of the majority of the workers are actually from the marine industry. Hence, we were able to sort of isolate them and did also a stop work order at the work site itself. Now, for the balance in the other block itself, these are the ones that I mentioned earlier on, they had high CT value. So that's the one that's still undergoing investigation at the NCID.
Well, thank you. I think that's the last question. I just want to thank all of you for being here and also to remind all of us that the virus is also evolving. Even as we refine and calibrate our measures, we need to watch the development and evolution of the pandemic very closely, not only in Singapore, but globally, so that we are able to be in a position to respond quickly and to continue to refine our measures. And I hope Singaporeans will understand that from time to time, we do need to recalibrate our measures, both at the border level as well as domestically, whether it's in the dormitory or in the community. We do expect our measures to be adjusted from time to time. So once again, thank you very much for being here.